Thank you all for joining us today. Welcome to Advancing Nurse Leadership Through Board Service. Today, we're here to take part in a conversation between nurses on the crucial topic of serving on boards, the importance of individual contribution to the boards or boards that they're on, and the board's role in creating a positive impact in communities, and how to serve if you're not serving currently. I've been fortunate to connect with all of these wonderful people through a collaboration with the Nurses on Boards Coalition. NOBC and AARP have a common goal of engaging more volunteers in leadership roles, like serving on boards. The speakers today are all working closely with me and AARP to support existing board members, identify new opportunities to serve, and also influence our advocacy work. We're fortunate to be joined by several experts in the field who serve on multiple boards and have for many, many years. I threw in a couple of manys there. They'll be sharing what drives them, what impact they have had, and how you too can serve on a board. So thanks again for joining us for this rich, informative conversation today. Leading the conversation are three special guests and several others that'll be on a panel conversation. Each of the three that I'm about to introduce have nearly 5 decades of service, of holding roles on both local and national boards. And that's decades themselves. So very rich in experience. First, we have Sue. She's currently a fellow of the American Academy of Nursing and vice chair of the Commission on Accreditation in Nursing, Continuing Professional Development. That's a mouthful. She's also certified in nursing professional development and as a nurse executive. We've got Connie, who's been a staff nurse to chief nursing officer and nursing educator throughout her career. Served as president on at least 2 national boards and currently serving as a chairperson of the boards of a local nursing home, assisted living, and a hospice palliative care organization. And last but not least, we have Flora. Her career began as a Navy nurse during Vietnam conflict, serving on the AARP California Executive Council currently, vice chair of Riverside County American Red Cross, and most recently supporting the chief nurse of the Red Cross as a coordinator of 2 programs. Ladies, many thanks for your service and for leading this discussion today. And again, to all of you that are going to be speaking today as part of your experience, and to all of our participants today for joining the conversation. So over to you now. Thanks a lot.
Thanks, Will. Yeah, it's a very great pleasure to be here, and I want to welcome all of you for joining us. As Will mentioned, the presentation is called Advancing Nurse Leadership Through Board Service, and we're so excited to have you here to learn from the experts that will be on the panel talking about how they got engaged, why they stay engaged, the different trials and errors and happiness that they brought in their service on the board. After the presentation are finished, we will be able to answer questions. So if you have questions, please use the chat box. Flora will be monitoring the chat box, and then I will turn it over to her after the speakers are done to sort of field the questions and have the speakers answer them. So we are ready to begin, and I'm going to introduce each speaker as they're going to give their remarks. So the first speaker we have today is Dr. Stephanie Almaden, and she is an established leader in healthcare. She has served in many executive leadership roles for multiple health systems. Dr. Almaden is an avid speaker about ethics and organizational accountability to protect resources and about health policy and equitable access to care. Dr. Almaden served on multiple national and local boards, as well as in advisory roles, and has enjoyed membership and leadership roles in many different councils and committees. And she's a pleasure to work with. Those of us that are happy to be on the nursing leadership for AARP are very excited to have Stephanie on that team. So Stephanie, what sparked your interest in joining a board?
First, I want to thank you, Connie, for the introduction, and thank AARP for having this forum and for the honor of serving on the Nurse Advisory Council. what brought me into this really, I've been always started as a rebel, never satisfied with the status quo, always thinking, how can I improve things and elevate how we deliver care. So raising my voice got the attention of a leader I worked with many years ago back, early in my career. And she said, you want your voice to be effective. She called it a roar, actually. She said, you want your roar to be effective, you have to have a seat at the table. And that clicked with me because it was something my mother, who was an educator, always told me. You never complain, you just dig deep enough within you to make a difference and be that change you like to see.
That's just a wonderful story, Stephanie. Thank you very much. So what's been the most challenging part of board service for you?
I wouldn't say a challenge looking back at the different areas I served in, but maybe what I perceived earlier in my career as a barrier. As you hear me, I do have an accent. I don't know why, 44 years living in the US, but I do. At the beginning, it made me a bit uncomfortable and trying, to assert myself, focus on raising the voice that I was meant to do, making a difference. So I'm blessed with patience and confidence in my skills and abilities and now what I bring to the table. So I stopped seeing that as a barrier over time and focus more on the positive changes that I bring to the table.
Thank you. And what was the most...
And if I might add to one thing that resonated with me a lot is what the late Ruth Bader Ginsburg said. What we often see as an impediment is actually is what can turn into a great good fortune. So I kept always reminding myself of that mantra.
Sure, that's great. I mean, I really think we all believe that. And thanks to Ruth Bader Ginsburg for bringing that to us. What was the most formative in your work experience that provided you to provide better service to the board?
I would say it wasn't one thing, but rather a convergence of many factors. My work experience got me into different settings of healthcare. So I've worked with health plans, I've worked with hospital systems, I've worked with medical groups, ambulatory clinics, community service, as well as academia. It was also a personal thing, having, leadership skills, passion, and particularly about patient equitable access to care and patient advocacy issues. And my, I'm a clinician, obviously, but also my studies and my research as a doctor in health services, it was all a convergence of different elements that allowed me to bring about change and also to lead effective teams and elevating what we do and having a bigger influence and a bigger impact on patients, families, and communities' health.
That sounds so inspiring. And so how has serving as a nurse on boards impacted others?
I would say, it's very, very critical to have a nurse's voice on a board, regardless of the industry that board serves in, simply because our training, we are problem solvers, we fix things, we bring the advocacy, the passion about doing better and better service. So, for example, I was serving on a board that is not necessarily a healthcare board, but issues were raised related to safety. And that's where I sort of charged with my background in nursing and in healthcare to bring that perspective to the table and bring about modifications in how to approach the discussion.
Yeah, and again, thank you so much, because that's one of the things that nurses do bring to boards. It's not that it necessarily has to be a healthcare board, but boy, talking about safety in the community and diversity and inclusion and all of these things that are happening in all over the industries now. So thank you very much, Stephanie, and we'll be looking forward to questions later that you'll be answering. Thank you.
Pleasure. Thank you.
Our next speaker is Gail McGill, and Gail's nursing career spans more than 40 years and includes extensive experience in nursing administration, quality management, hospital operations, strategic planning, and regulation of nursing practice. Gail has worked in not-for-profit and proprietary areas of acute care and critical access hospitals, including work with specialty hospitals. Most recently, and this just warms my heart when I have to read this, most recently at Shriners Hospital for Children in Salt Lake City. She received her BSN from Seattle University and a master's in nursing and healthcare administration from the University of Alaska in Anchorage. She has held board certification as a nurse executive advanced and a Wharton nurse fellow, executive fellow. Gail has served in many organizations during her career and currently is a member of the American Nurses Association and the Nevada Nurses Association. Her board service experience includes local and national organizations in health and education. Currently, she serves on the leadership board of the National Education Progression in Nursing organization and is co-chair of the Special Interest Group on Equity, Diversity, and Thriving in Nursing. Gail is energetic and passionate, which you're all going to learn when she starts answering her questions, about academic progression and increasing diversity in nursing. She enjoys the time she spends now on as an AARP Nevada volunteer, serving on the Staying Sharp team, helping other seniors maintain healthy brains. So welcome, Gail. We're so happy that you're here and joining us. So tell us how you first began serving on boards.
Well, thank you, Connie, for the introduction. And well, when I was in my baccalaureate education, the faculty said, you know, you should belong to your professional nursing organization in your career, whatever, the American Nurses Association or a specialty organization, it's very important. And being part of those organizations can help you learn about jobs, continuing education, and other opportunities. So my first foray into serving on a board was as a member of the Alaska Nurses Association, where at some colleagues' suggestion, I ran to be on the board and was elected. I was only 4 years out of my baccalaureate program, and so was a good experience in leadership, and it began my professional networking.
Which obviously has continued throughout your career. So what was the most common way for you to become involved with board service?
A knock on the door, was really it. I would be nominated by colleagues, and it's just answering the call when one came. That seemed like it would be a good fit for me. And one day I got a call from the Alaska Governor's Office and asking me to serve on the State Health Data Coordinating Committee, which I wasn't quite sure what that was at the time, but it's a board that advises the state administration on Medicaid, the resources for Medicaid. And I later learned that a friend I skied with had recommended me. They knew that the organization needed a healthcare professional and went, they should have a nurse. So that's how I got started in them. And then, interestingly enough, years later, I got a call from the Utah Governor's Office to serve on that same board. But it's really about answering the phone when someone calls.
Absolutely. Absolutely. So what benefits have you received personally from being on boards?
Well, there's a lot of benefits in the networking opportunities that you have and meeting new members of the community that the board is in or the board is serving, that's serving. And it's a good opportunity to network when you're on nursing and healthcare boards and look for new opportunities for work if that's something that pops up. And always a voice for nursing at the table and for healthcare in general, since as a chief nursing officer, you're responsible for generally all of the healthcare professionals in the organization. I had lots of experience with a lot of the other professions too, so I could help represent them as well.
That's great.
And you realize the impact of the decisions that the board realizes the impact on the communities better when they have healthcare professionals, nurses involved. And another opportunity is to learn more about your community. And I was serving as a hospital administrator of a very small community hospital at one time, and then got appointed to the technical college board in the area that served the place where I worked and the place where I lived. And so that was really great. And then I met community members who I was able to say, hey, what is about the fact that the front yard of my hospital has soccer fields in it? So anyway, what is the history here? So you get to network and find out a lot of things by being on different boards.
Oh, that's a great story right there, to say that, yes, you learn too from the people that you're now engaged with. It's not only us being there to contribute, but then we also learn more and more things. That's great. So what's your recommendation for where people should find board service opportunities?
Well, a good place to begin to serve is with the organizations that you belong to. Get on a committee, and then board positions in some organizations are elected and some are appointed, and so you can learn about that. Your governor's office is a good place to look to because they keep lists of positions, boards that have openings. And then ask your mentors and your colleagues for suggestions if you're interested in serving. And nurses on boards, sign up for nurses on boards because they send out emails of organizations that are looking for nurse board members. You can also attend meetings that are open to the public, like school board meetings or assembly meetings, and not-for-profits such as community health organizations, and find out about opportunities. And also sometimes you can find out about them through your religious organizations. One of the church I belong to, our family belonged to in Park City, that church was instrumental in starting the People's Health Clinic. And so, there was another knock on the door. Gail, how about serving on the board? So.
Thank you. That's impressive, the list of opportunities. And you're right. You have to just go out and look. Also, I would just add to that sometimes when I want to add people to a board, like my hospice board or my nursing home board, I actually invite them to come to a meeting and see if they're really interested. Sometimes I think they should be, and they're like, no way. But so just another way to do it is to get invited, to have somebody invite. So great. Thank you, Gail. And again, we'll hear from you again when the questions start rolling in. And I think they're going to start any minute now rolling in. Our next speaker is Dr. Gina Miranda Diaz. And I'm going to read a little bit about her, but then she's going to tell you all that she just got appointed to a very important position in New Jersey. So hang on a minute. So Gina is board certified advanced public health nurse and certified contact tracer. As a New Jersey licensed health officer in Teaneck, New Jersey, and the former director of 2 health departments in the state, she informs the community in English and Spanish about culturally appropriate approaches to health and wellness, while advocating for environmental and social justice. She has collaborated with numerous organizations, including AARP, the American Diabetes Association, and the American Heart Association. In March, she became the American Heart Association spokesperson to educate Latina in the United States and in Latin America about COVID-19 related topics. Now, what did you just get appointed to, Gina? Tell us, the governor's commission?
The governor created legislation to form a panel of about, I think it was 10 to 12 experts about the COVID-19 pandemic task force for health, to reduce healthcare disparities.
That is
So,
amazing.
I'm very
Congratulations.
excited.
Really,
Thank you.
Congratulations. So back to the bio. For over a decade, Gina has been a member of the executive board of the National Association of Hispanic Nurses, New Jersey chapter, and is past president of that chapter. She currently serves on the bylaws committee for the National Association of Hispanic Nurses. Gina has also served on several other boards, including the New Jersey State Board of Nursing, American Diabetes Association, Social Services Advisory Board in Teaneck, New Jersey, and the Teaneck Municipal Alliance Against Alcohol and Substance Abuse. She has lectured in academic settings about public health and has delivered podium presentations in the United States and Puerto Rico. She has volunteered with the American Red Cross and Medical Reserve Corps and has lectured widely on public health topics. Since May of 2020, she has partnered with a colleague to vaccinate and test vulnerable populations against COVID-19 from their, quote, My Mobile Clinic, end quote, van. So she drove around with her buddy and they stuck people in the arm.
Right.
She has received numerous awards for contributions to nursing and public health, including being named a fellow of the New York Academy of Medicine. So Gina, welcome, welcome.
Thank you. Thank you so much. It's such a delight to be here with all of you, among all my learned colleagues.
So what first brought you to volunteering on boards?
There was an opportunity to, I was asked to be on a board because of where I was in the workplace. And I thought it was an opportunity. They were really happy to have the opportunity to have somebody who was a nurse, who was a medical professional, because by and large, they were community-based organizations that really didn't have any sort of medical personnel or contributions. But what I found was that it was less medical and more about the public and how we see the public and how we interact with the public. And Sierra Coop, he was the Surgeon General during the Reagan administration, said, healthcare is vital to all of us some of the time, but public health is vital to all of us all of the time, because we all live in the public. So being in these communities and learning about these communities is so important. You just don't want to parachute in, think you're going to fix everything and leave. So I was invited to be on a board, and then I just continued to get these invitations and go into boards that really interested me. And sometimes they didn't, it wasn't for me, but for the most part, I really enjoy contributing and being part of something larger than myself in the community.
Yeah, and it obviously the community has very much benefited by you being present and on these boards. So I'm going to pretend that I'm novice, and I've never even looked at a board before, and I'm really novice in this work. What advice do you have for me as I search for a board role?
Something that you're passionate about, something that speaks to you. You may be curious about something that you know nothing about. You may want to be on a board with to learn a little bit more about it. Or there's something, in my case, my mother is diabetic, my grandmother's diabetic. So the American Diabetes Association had an arm of that organization that was specifically geared to Latinos. And very often Latinos say, I have a touch of sugar. I just have a touch of
Yeah.
sugar. And a touch, it has a broad definition. So it was important to me to learn more about it and to see how I can help educate folks in the community, especially since I'm bilingual in English and Spanish.
So one of the things I'm hearing you say is find something you're really either want to know more about or that you're already passionate about,
Right.
and follow that pathway.
Follow that wherever it takes you.
Great. So I know it can be overwhelming, and when I read how many committees and boards and activities you're on, how do you make your first steps? Because I'm young and I don't know, I'm busy working. How am I going to get on a board? So how do you make sure that you're ready?
Well, you can always volunteer. Ask them if you could sit in on a meeting, and realize that board meetings don't happen every week. Usually, sometimes they meet quarterly, sometimes they meet monthly, and find out what your commitment would have to be. You don't have to have any special skills. Just having you there and having your perspective is quite enough. So really think about what's the time commitment. How much time can you commit to that? Sometimes it's not a whole lot. And you can always start by saying, as we often tell our new members, you're not obligated to do anything. We're all volunteers here, but we'd like you to come as often as you can and find out if this is something you want to do. Can you give a little time to it? You don't have to devote a tremendous amount of time to it. And maybe it could just be volunteering on a committee. I can't make all the meetings, but I can help you with this event, or I can help you with, sometimes I would help with Susan G. Komen for the Cure, and they had a 2K race or 5K race, I apologize. And so I recruit people, they would come for the one-time thing and they would feel so good about it. And some people would say, you know what, I want to stay on a little longer. So you could start with small steps, volunteer, maybe just join a committee or a group for an event, and then take it from there.
That's absolutely wonderful advice. Thank you so much, Gina, and congratulations again on your governor's appointment.
Thank you.
Our last speaker is Dr. Catherine Campbell. She's unable to join us today. I am going to read her bio, and then we're going to watch an interview that was taped with her so that you'll all get to hear Catherine's really wonderful stories. Catherine has a doctorate in nursing practice and a master's in business administration. She's a retired professor of nursing. Her professional commitments has led her to participate in committees and boards of director positions, utilizing her experience in improving the outcomes in healthcare. Participating on boards has advanced the nursing voice for her. Board positions have included Dallas-Fort Worth Case Management Society, the National Case Management Society of America, the National Institute of Health Precision Medicine Project, American Association of Kidney Patient Advocate Board of Director, and the AARP Dallas-Fort Worth Public Policy Board. Along with leadership experience in her personal career, Catherine views herself as a patient advocacy leader and has participated in many Hill Days. In other words, going there and advocating for patients and healthcare, which are vital to moving patient-centered care forward. Catherine believes equity of healthcare is a factor necessary to improve diversity and inclusion in healthcare. Building relationships and developing trust is a requirement to ensure healthcare equity and positive clinical outcomes among all patients. So we'll watch the tape. Board of Director leading.
Thank you, Connie. As you mentioned, case management board of directors, that's where I began working autonomously, and my type A personality determination was recognized, and I was encouraged by colleagues to run for offices on volunteer boards. And I really believe that our voice at the table is very important. I had significant educational advancement, as you mentioned, my Doctor of Nursing Practice, which allowed me to be professionally advanced as CEO, CNO, and Board of Directors. And I have been very fortunate to have people alongside me to mentor me.
And I'm sure you're a great mentor to the people coming with you as well. So what motivated you to want to be on boards?
Well, I think my vision, as I noted through case management, there was more that I could do by working autonomously, that I had a voice, that I could go to the chief nursing officer and say, I think we need to make some changes here. And advancing nursing vision and mission. And without us being on boards, our disparities in helping patients are really limited. Of course, we don't just need to be on a nursing board. There are other boards that are successful in hearing our voice.
Yes, and I think you represent your voice on some of those boards that are very important for advocacy for patients. So what is your commitment to future leadership?
Well, my commitment continues to volunteer on boards, of course, without pay. And I think that's an important thing that everybody needs to understand, that we don't necessarily get paid to be on boards, that it's a volunteer action, and that our vision as leaders, as nurses, can be shared throughout any board of director positions. And presenting as a volunteer exacerbates the image of nursing. Almost daily, I've received invitations for board positions, committee positions, published articles, and it's an honor to represent our trusted profession, nursing.
So,
We may have
Catherine,
lost a little portion of that video. Connie, do you think you can continue on from here?
oh, sure, we're good. We're good from here. First of all, I want to thank all of the panelists for their contributions and the stories that they've shared. They, each one entered their pathway to board service in a different way, and many of it was similar, following their passion, looking for how they could change and influence. So I'm going to now turn this over to Flora, who's been monitoring the chat box, and she will definitely take hold here and ask the panelists the questions that she's seen in the chat box. And at the end of this presentation, there'll be a slide that contains contact information about the presenters and the other members of this team, so that if you have any other questions, or if you want to engage any one of us to be your mentor, or to figure out a way to get you to the boards, we're willing to do that. So at the end of this, you will see that. And we hope to do a follow-up session after this one to, again, look at how to develop people to move toward board service. So go ahead, Flora. Thank you.
Thank you, Connie. And you have teed up the first question perfectly. And it's coming from Gail DeWald. So for those of you who may not be monitoring your chat, as I'm reading Gail's question, please put your general and speaker-specific questions in chat, and we'll get to as many as we can. So Gail, thank you very much for submitting this. Per Gail, I've long been active on the local and national nursing organization, American Nephrology Nursing Association. She's chair of the leadership committee, and this year they became an organizational member of NOBC. Good work. We have several boards who want us to recruit members for their boards. She sent many emails, but no luck in finding someone. So she's asking the group, the panel, what do you suggest we do besides volunteering herself? And she's already on 3 boards. So I'm going to call on my colleague who has not yet had an opportunity to share her voice, Sue Johnson. Come on down and tell us, give Gail some good advice.
I will tell you, yes, do not volunteer yourself for any more unless you're ready for that. you have some people that you know who are within the association who would be great board candidates. At this point in time, have them attend a meeting of one of these boards with you and some of the individuals on the board so they can become acquainted. It's difficult to say, I want to serve on X board if I've never seen how X board functions. So encourage them. If they have an interest in a topic that a particular board is working on, ask them to come with you and talk with the members of the board. They don't have to volunteer initially, but they may find there is something that board is doing that will support what they want to do within their community. You are not going to get everyone on every board and every board seat filled immediately, but I guarantee you, you will do a lot better if you introduce them to concepts that they want to work with. So see, I think it was early on when Stephanie was talking, and she said, I want to be passionate about what I do. I do too. We all do, those of us who have worked with boards. If you have passion, it will move you forward to board service. So start slowly, work with them, answer their questions, and give them a reference person that they could work with beyond there. That may help you to move them forward.
Thanks so much, Sue. The next question comes from Jean Ross, and I've got to slow down my chat so I can read it well. And it's actually a very good question because, Jean, I want to let you know that the panel, we actually kicked this one around as far as putting it into our presentations and thought we'll hold it off in case someone asks. So you're spot on. She wants us to share a story of when a board was not a good fit. What did it look like and what did you do? So, Gina, you've had some great success, but life isn't always about the wins. So can you give us an example of a time when maybe something wasn't a good fit? And if you can't, if you've had only good fits, then we're going to send it to Gail.
Yes, I had one experience that it wasn't a good fit for me. And sometimes you think that what you feel is important may not be important to the group, or maybe they're shifting their goals. So I wanted to make sure that whenever I'm in a group, if I don't feel that the goals or what I thought the goals of the group were happening, I would voice my concerns. Is this going to happen? Is this the way it's going to flow? Are there going to be, is this how you want to, how you see this particular board moving forward? And then if it was, then I left. One of them had actually stopped the program that I was really passionate about, where it was only where it was focused on the Latino community, and I thought that was really a great thing that I was passionate about and that I could relate to. Unfortunately, the funding wasn't there and they couldn't continue, and so I decided that I would try to channel my efforts elsewhere, and it happens. It happens sometimes, but it's always a learning experience, so it's not terrible.
Gail, did you have a similar experience or some variation on the theme there?
Well, I think her experience was wonderful. I think that one of the things is, how do you extricate yourself when you're in a situation like that? And it's a good opportunity. Well, sit down with the executive director of the organization, the chairperson of the board, and talk to them about what your challenge is, and that they should look for another person to fill this position. For me, it was a strategic plan that I was really engaged in a strategic planning process. The process was over, it was implemented, and there was an opportunity, other things were happening, there were opportunities for other people. So I said, I think that some other people might want this opportunity.
Yeah, thank you both very much. So I'm going to throw this next question to Connie, just to keep you on your toes. Connie, why is AARP and the Nurses on Boards Coalition a good fit?
Well, I have a billion things to say why it's a good fit. The first one is the missions of both organizations is to serve. And, you know, Nurses on Boards, that's what we do. We serve. AARP is serving people who are aging and trying to provide and give a lot of support to those people. So that really makes us think alike, move forward alike, and introduces us Nurses on Boards to a whole nother segment of the community. And I personally am getting so engaged now in the New York AARP that I'm loving it. And I know many of the panelists here are involved in their AARP organizations. It is, again, that joint moving forward to care for our communities, whether it's diversity, inclusion, hunger. There's a lot of food things going on now with AARP, and we know how to do this. So it just is a marriage made in heaven.
I agree. And Stephanie, I'm going to set you up with the next question by providing this bit of information for our audience today. In 2010, the Institute of Medicine's Future of Nursing report called for 10,000 nurses to become members of boards across the country. And in the last couple of years, they actually achieved it. Ladies and gentlemen, on this presentation, over 1 million nurses are members of AARP. So linking Connie, and now Stephanie, here's your question. How have you had an opportunity as an AARP or before AARP volunteer to actually affect the trajectory and the decisions of the boards you sat on to serve the public?
Well, again, you know, I want to say sometimes it isn't just one element or one factor that makes a change. Sometimes it's a convergence of different elements.
Alex?
And also finding the synergy, you know, things like being active in AARP and volunteering. I always do that out of respect for what AARP is driving, because it has synergy with what we as nurses strive to achieve. And I'll give an example of a board that I served on where looking at equipment, you know, I don't want to go into details about what this agency is doing because it isn't out yet. But what I saw in it is that synergy between what AARP is driving and what the board wasn't aware of in terms of that synergy. So I focused on safety, and that is like community. I focused on the issues of equal access, because we all know climate change and the environment does affect health. And unfortunately, it affects health at varying degrees when certain patient population are in underserved areas. So I tried to bring all that in, my knowledge, my expertise, my healthcare background, as well as what AARP is driving and what this company is trying to do, and brought it all together to add depth and meaning to their mission, AARP mission, and our mission in nursing and our scope of practice and standards of practice in terms of impacting lives, and the ethical component of care, with the ethic of justice and doing a greater good. So just the mere fact of trying to bring all that together, to me, is extremely satisfying. It is what we work for. And I want to go back to our prior discussion where Gail and Gina interjected about pulling ourselves out of a board. Actually, what I always think of is maybe not pulling out, but sometimes trying to look at perspective, because sometimes we can bridge worlds by looking at perspective, understanding them, and finding that common good. And I had that opportunity once in service on a board, where initially I was very, very uncomfortable. And I was talking to myself if that's something I want to continue doing or even stay in that meeting, till I took a deep breath, so to speak, and I thought, no, there's a bridge somewhere that I can walk them through and find that synergy and greater good in the agenda.
That's great.
Thank you, Stephanie. I have one more little piece and then I'm going to turn it back over to Connie. And that is that I want to encourage everyone here. Now, Will Stoner, who represents the Office of Volunteer Engagement for AARP, has listed in the chat the NLBC website. If you are interested in serving on a board, you have more questions, or maybe you're already on a board and you're seeking a nurse. One of the great things about our partnership with NLBC is their algorithms are taking in everybody who enters and matching it up and sending out emails and sending postings and having newsletters. So please check into the chat. Just hang off, go to your right, hang in, because Will's got it all posted there.
Right.
And now I'll give you my 30-second of my example. So I've had the luxury over the past 3 years, and most of the 3 years has been in COVID world, of serving on a foundation board and bringing to that board of total non-healthcare individuals who thought they were focused only on the elderly, and brought to them an ability to understand from my perspective on my knowledge and my skills and my experience, the reasons why the social determinants of health that we've all heard and talked about affect every one of us. It was a phenomenal opportunity to have a healthcare voice at a totally non-healthcare board. I didn't have to lecture them. I just had to keep telling this story.
Right.
So I encourage all of you. You've heard some of my colleagues here talk about it doesn't always start with a nursing professional board. It might start there if that's where your passion is, but don't be afraid to apply for the water authority. Don't shy away from the school board. Too many of us are raising grandchildren, raising 2 or 3
Right.
generations below. And so those school boards, they need your voices as well. And with that, I'm going to sign off. I do see that someone has asked for the references. Winona, I know, is going to post it. Connie, you get the last words.
Well, thank you. And I too want to thank everybody who's been participating today in this call. And again, hopefully very soon we'll have a follow-up where we'll give more specific details on how to get engaged on boards. I want to thank Flora and Sue, the wonderful panel, Will and Winona. Will and Winona are our anchors to AARP. And they keep us straight on the straight and narrow for sure. And it's very, we love working with them, and they're part of us and we're part of them. So I really want to thank them. And I hope that this has encouraged those of you who are not currently serving on boards to begin to think about, how can I make change? How can I influence? how can I correct things that aren't going well? I just got elected to a board last week called Otsego 2000. And I'm really nervous about it because it's about outside stuff like taking care of the town of Cooperstown and taking care of the wilderness around there. And it's going to be fun, Otsego 2000. But it's something, you know, totally out of my current vernacular. So I'm going to have to learn a lot, and I'm excited. I'm excited to do it. So that's what you need. What is it going to take to get you engaged and involved? And we thank you, all of us thank you so much for today and for participating, and be well, all of you, be well. The slide is up. All of our emails and names are there, so.
Thanks, everyone. I appreciate you.
You're welcome. Sorry, my battery almost died, so I had to run and get a plug.
Let's
What
hang
a day.
on, let's hang on until all the non-participants have signed off.
Yes,
Okay.
Okay.
that sounds great.